Lifting and handling human beings is a dangerous business, and nurses get much unnecessary back pain. 4 out of 10 of them suffer back injuries from lifting. These numbers are probably equalled by carers in local authority and private homes and in the community. Simple aids can help to reduce the load, and this video shows you the correct use of 2 such aids. The Medisign handling sling and the hand blocks. Lifting and handling is a practical skill, and you must try to improve your skill. There are some golden rules. Assess the need to lift. Can the patient help you or herself? How many helpers do you need?
Leah, you all right? Yes, thank you. We've got to get you back into bed. Yes. Put that hand here, please.
What equipment should be used?
Clasp your wrists for me together. That's it. Lovely. Soon get you back into bed. Ready? Brace. Lift.
Which lift will you use?
Stand up. Walk.
Arrange the furniture to give correct heights, clear access, and put all the brakes on. Agree the grasps and make them safe.
You can grasp your wrists.
Agree the commands and tell everyone.
Ready? Brace.
Check the posture of all the lifters
Brace.
and stand
Lift.
or kneel close to the load. This is a human vertebral column, and there are 3 natural mobile curves. One hollow in the lumbar region, a hollow in the neck region, and a curve backwards in the thoracic region. When you bend forwards, the lumbar curve, which is most often injured, is eliminated, and the lower back loses stability. When you reach with your hands outstretched and bend your back, the length of the lever is very much greater, and the load on the back multiplies by up to 10 times. Now watch this correct lift. Hips and knees bend. The load is near and in front of the lifter. Now look what happens if the load is at the side and the feet are together. The back twists, and the load on the back has just doubled for this reason. Foot positions are very important in lifting. Your feet should be placed to allow you to carry out the handling task with good balance and necessary body movement. In 3 of the foot positions, the leading foot should point in the direction of the proposed movement. Straight lunge. In this position, one foot is at right angles to the other and the feet are apart. You can move your body weight between your feet. Use this position at the side of the bed. In oblique lunge, the feet are at right angles to each other and a step away from one another, both in the forwards and sideways direction. The trunk and hips can be turned as the weight is transferred from foot to foot. Block the feet with one foot and put the other foot beside the chair. Ten to 2. Heels together, toes apart. And it is a blocking position to prevent the patient's feet from slipping. It is usually used prior to standing a patient up. One step back with one foot may be needed to help to keep the balance. Walk standing, another position for forward and backward movements of your body, used for standing a patient up when the patient's feet do not need blocking and the patient needs little help. The arm support used is a forearm support. Note the lifter's straight back. Throughout this video, watch how the lifters move their own body weight. This is the Medizyme lifting sling, the use of which is shown in this video. One side is shiny for contact with the sheet, and the other side is contoured for contact with the patient. Slide it under the hollows and pull it into position. Hold with an inner grasp if you are near the patient, as in kneeling, or with an outer grasp if you are further away from the patient, as in standing. Never put any of the slings into the bath, and do not use the sling on a patient who is very wet until you have dried them, or who is lying on a wet bed. It is dangerous because the sling will then slip. The hand blocks. The human arm is not long enough to push on a spring mattress and allow the body to be lifted. All that happens is the mattress is compressed. Making a fist lengthens the arm but compresses the mattress more. By using a lifting block, the patient can move up or down the bed, allowing the buttocks to be clear of the bed. The shoulder lift is one of the safer lifts and least likely to injure your back. Adjust the bed height to mid-thigh level. Put the brakes on. Stand in straight lunge. Put your nearest shoulder under the patient's armpit from behind so that it rests on the middle of your shoulder. The most difficult bit is to reach under the thighs and grasp without moving your shoulder. Put your other hand palm down and elbow bent on the bed, level with your forward foot. Watch the elbow straighten. Move your feet and the hand on the bed to do another lift. The load on your back in one long lift is more than the total load for two short lifts. Now watch the same lift using a sling. Note the outside grasp, there is less distance to reach, and the back flexion is noticeably less in the lifter nearer the camera. If the bed is low or can be lowered, the lifters can kneel and get much nearer the patient. We have a problem here. The two lifters are of different heights. They perform the shoulder lift in kneeling, which reduces the difference in heights. Note their feet are not on the bed. They now use the handling sling with an inside grasp and the same commands. Alternatively, the smaller lifter can stand, adjusting the bed height for her. The taller lifter kneels. Both use an inside grasp on the handling sling and the same commands. If a hoist is not available, this lift can only be performed on a lighter patient. Take the patient to the edge of the bed by rocking. Put the sling under the thighs. Keep your thighs against her knees to prevent a fall. Take the shoulder lift position. Put the rear hand on the bed with the elbow bent. The commands are ready, brace, lift and stand up, walk and pivot. Hold the chair and lower. For a patient with one able arm, a shoulder lift with one lifter and a hand block is used. For the lift, the patient must be allowed to initiate it and the lifter joins in. Observe what happens later when I say now. Good. Now if I look after this side, and you lift yourself up on the best side, we'll get you up the bed. Ready? Push on your hand and your heel. Now, push. Bring your hand back and your heel back and push again. Now, push. That's it. Good. Let me have that after you're off the bed. This is the original Orthodox grasp, which you should avoid. Look at this attempt to do the Orthodox lift and see why you should avoid it. They stand too far away, they reach too far, they lift on the ends of their outstretched arms, and they bend their backs. Using a handling sling, the Orthodox lift can be modified. Watch the difference when the sling is used. If the patient can be rolled, turn the head in the direction of movement. Cross the arm and leg over in the same direction and roll. Insert the slings. Everyone uses an inside grasp. The lifters have straight backs because they are lifting with their hands nearer to them. Never lift a patient's pelvis either alone or with two lifters, one of whom lets go to perform the nursing task. Insert a handling sling and the lifters stand in walk standing, lean back and the pelvis rises. A fifth person carries out the nursing procedure. If a patient has a chest or shoulder condition on one side, which prevents the use of the shoulder lift on that side, use a half shoulder, half modified Orthodox lift with a handling sling. Note that both lifters kneel. They use an inside grasp on the handling sling. The person doing the shoulder lift can exert more power and will tend to lift so that the patient travels obliquely up the bed towards the other lifter. The lifter on the affected side places one hand centrally under the buttocks. The through arm grasp can be performed by one taller person. The patient grasps one forearm with the other and the lifter grasps the patient's forearms. Two other lifters grasp the handling sling. Here is a floor-to-chair transfer, and the trunk lifter is taking 70% of the load. If two persons each use the through-arm grasp and a handling sling, then the load is shared, as in this lift, up the bed. The other two lifters lift the lower limbs. Some lifters kneel, some stand to overcome the height difference. The through-arm lift with a handling sling from a bed to a chair. First, sit the patient up. Put one arm under the patient's shoulders. Grasp the bed edge with the other hand. Pull on that hand and move your body weight sideways. Watch it again. Now use the sling to pivot the patient so that she sits sideways on the bed. Get the wheelchair and put the brakes on. Either stand or half kneel on each side, and if necessary, lift in short stages to the bed edge. And then onto the chair. The through-arm lift with a handling sling from the chair back to the bed. Remove one arm and insert the sling by rolling the patient to one side. Ask the patient to help. Take the other chair arm off before pulling the sling through. Get extra help.
You can press the wrists.
Note the hands on the knees help to push the lifters upright.
Ready? Lift.
When patients have fallen, they should be checked first.
Yeah. Fall out there. Are you all right? Yes. We better get you back into bed, haven't we?
Then get help and the lifting equipment.
You have your wrists for me.
If the patient is light, you can use the through-arm lift for one lifter and two handling slings.
Ready? Brace. Lift. Stand up. And walk.
Walking patients sometimes fall. They may warn you or just become heavier. Do not try to hold them up or to reverse the fall. Practice this with colleagues. Get a hoist and the handling sling and lower the hoist seat. Use the shoulder lift and an inner grasp on the handling sling. Watch the lift again and note the rear hand is put on the hoist frame to push. In a seat-to-seat transfer with the handling sling, place the two seats at right angles to each other and touching at the corner, both braked and stabilised. Rock the patient sideways and bring her to the front of the chair. Put her thumbs in your pockets. Put the sling behind her buttocks. Stand at 10-2 and block her knees. Lean back and lift and turn on your feet. To put the patient further back in the chair, lean her forwards. Use the sling behind the buttocks. Stand at 10-2 and block her knees at the front. Simultaneously, pull on the sling and push on the knees. The key hand positions for support in standing are one hand on the bony area at the top of the cleft of the buttocks and one hand between the shoulder blades. Always move the hand down first. To stand a patient up from a chair using a handling sling, Put the patient's feet on the floor under their knees. Put their thumbs in your pockets and lean the patient forward, head over their knees. Rock her to the front of the seat. Put the sling in position on the buttocks. Stand her up by leaning back yourself. Move your hands, one down, one up, to support her. And to sit her down, replace the sling on the buttocks and press gently on the hips. On the 31st of December 1992, the European Community regulations on manual handling of loads came into effect. You will need several books in order to put these regulations into effect in your own work area. The first book you will need is Manual Handling Guidance on Regulations, which gives you information about the general regulations for all manual handling tasks. The second book you will need is Guidance on Manual Handling in the Health Services, which is guidance on handling human loads. The third book is the book published by the Royal College of Nursing and the Back Pain Association, called The Guide to the Handling of Patients. And this tells you how to assess loads, which is a requirement of the regulations, and how to deal with those loads. And the fourth book is my own book, called Safer Lifting for Patient Care, published by Blackwell Scientific Publications, which gives you great detail on the majority of lifting tasks which you are likely to perform on human beings.